I am Emily, the Community Relations Director at Evergreen Place. I'm just going to introduce Dr. Khan from Unity Geriatrics. He comes and visits our patients here, and I will turn it over to him for his presentation. If everyone can put themselves on mute, please.
Hi, I'm Dr. Khan. I work out of, like Emily said, out of Unity Geriatrics. Me and one of our PAs come out to see all of our patients over at Evergreen. I think we have probably a little over half or a little under half of the population at Evergreen that are our patients. I'm just going to introduce a little bit about our practice just so you can get a little bit of background on what we do and why we have an interest in getting as many people vaccinated as possible. So our practice covers a wide variety of physical locations. You know, we work out of a clinic setting. Many of our providers go out and visit other assisted living facilities. We go out and cover nursing homes, and we also go out and cover the hospital for our practice. And that would be Unity Hospital, or what was previously Park Ridge Hospital. So, you know, we've seen a lot of COVID in all of those settings. I'm just going to start off with some statistics for our community, and then we can go into more specific questions, or if anyone has specific questions, we can go more in detail into those. So as of Saturday, our weekly positivity rate in Monroe County is about 7%. That's actually an improvement over the last couple of weeks. For example, the week before it was 9.5%. Which is quite high. Our goal is to remain under 1%. So 7% and even 9.5% is quite high. But we're getting down. Our hospital numbers in the county are improving. We were, at least I can speak from the Unity Hospital end of things, we were quite full, over capacity. But the hospital itself is improving with regards to the amount of patients. That being said, the ICU is still critical. At Unity Hospital, we're 200% full on the ICU beds. So they've doubled up on ICU beds wherever they could, and they're completely full. Some of the things that are relevant to us and what we've seen, fortunately, Evergreen has not, which is the significant amount of death that comes along with COVID. In the nursing home setting in our county, it's closer to 20% of people that get COVID end up dying in the nursing home. And in the ALF setting, in the assisted living facility setting in our county, in Monroe County, it's closer to 14%. So it's a little lower, which is expected because the elders who are in assisted living are generally a little healthier than the elders that are in nursing home. They require more care. There's more frailty, and they're a little sicker, unfortunately. I can continue to go on and talk about the vaccine, but I think it might be a little bit more interesting if you can get some questions from the group, and I can try and answer some of those questions about the vaccine. I think they are going to start vaccinating on the 24th at Evergreen, and it's going to be the Pfizer vaccine. And from what I understand, it's going to be CVS. So assisted living facilities and nursing homes have to either reach out to CVS or Walgreens. And I think Evergreens has some sort of understanding with CVS, and they're going to be coming out on the 24th to do the first round of vaccines. So I just want to open this up to any questions people may have that I can help answer. And if not, I can continue to go on and talk more about the vaccine. So I'll open this up to everyone.
I have a question. So how long after you get your first vaccine until it starts to have some type of effectiveness? Because since it's a two-part vaccine, how much protection do you get from that first one?
That's a good question. So far, the data is showing that after the first 2 weeks of the first dose, you're close to 80 to 85%. 2 weeks after the second dose, closer to 95%. And I'm talking more about the vaccines that are currently approved, which are the Moderna vaccine and the Pfizer vaccine. There's another question that's on the chat. Is the second shot scheduled at the time of the first shot? I think Julie may be able to answer that question a little better. From my understanding from some of our other nursing homes, they're scheduled. So if you get your first shot, let's say on the 24th, you automatically get sort of first dibs on the second shot 3 weeks later. But Julie may be able to answer that a little better.
Yeah, that's correct. We already have our second clinic scheduled for February 14th. And then there will be a third clinic that's scheduled just in case we have some people that missed the first two.
Any other questions that people had today?
Yeah. Yes, I have a question. My mother has been, well, she had a pneumonia in one of her lungs about a month ago, and she took antibiotics for it and it cleared. And is there any concern about her getting the vaccine at this time?
So I think that's a good question, and we can go into a little more about who can't get the vaccine, because that I think that's a good question. So with regards to prior pneumonias or any other sort of illness, there really isn't any what we call contraindication or any reason to not get the vaccine. So if your loved one had pneumonia recently, even as recently as a couple of days ago, they should be able to get the vaccine. So people who can't get the vaccine, or maybe people who shouldn't, so people who have had COVID within the last 10 days, those people shouldn't get the vaccine. People who have active COVID, active coronavirus, those people shouldn't get the vaccine. And then people who have had allergic reactions to the COVID vaccine. So for example, the first round is going to be on the 24th. If you end up having an allergic reaction to the vaccine, more likely than not, you probably wouldn't be getting the second dose of the vaccine. You would have to rely on the immunity for the first dose. And lastly, people that are really end of life. So what we mean by end of life is people that have days to live. Those people may not benefit from getting the vaccine because they may not live to see the benefit from it, unfortunately. But everyone else, you know, they're, as of now, they're able to get the vaccine. I would highly recommend getting it because, you know, it just wreaks havoc, unfortunately. Did I answer that question? So one of the questions on the chat is asking, can you still spread COVID after receiving both of the shots? And again, that's a very good question. So some things that we know from prior, so there's some assumptions that we make from prior vaccines. So other vaccines, when you get them, for example, the flu vaccine, you don't necessarily spread the flu. That being said, we don't have enough information yet. The first people that got the doses of the COVID vaccine are about 8 months out. So it'll take another couple of months, I think, for the studies to be complete to tell us if they can still transmit the virus. So they may not get sick from it, but they may still be able to transmit it. And that's why we all still need to wear masks and that kind of stuff until we can get more data out. That being said, you know, just based on other vaccines, we're hopeful, you know, that we'll be able to prevent transmissions with the current vaccines. But we can't be 100% sure. So that's why we're still all wearing masks and shields and all of that stuff. One other question asked, will they have a COVID test before the vaccine? I don't think so, unless, so for example, facilities, assisted living and nursing home are under executive order to test all of their elders and staff if there has been a COVID case within the last 14 days, and they're required to test every 3 to 7 days. So outside of that, there really isn't a requirement to test COVID. I think one of the benefits of being at Evergreen is there hasn't really been any outbreaks, any elders that have gotten COVID, or at least not from being inside the facility. And I think that probably is, I think it's probably one of the few facilities out in our community, out in the county, that hasn't had it. And so I think we definitely benefit from that on all ends. And one of the question asked, since it's 95% after the second dose, can they still get it, but it is not as severe, or can it still be severe? And those are both good questions. So if you've had the vaccine, the second dose, after 2 weeks, you're about 94 to 95% safe. So what that basically means is you shouldn't be able to get the virus or be sick from it. That being said, if you're in one of those 5% of people that does get the virus, we're hoping it's not as severe. But that's also not 100%. You could still get the virus and still be pretty sick from it if you're in that 5% of people that unfortunately just weren't covered by the vaccine. I think as we get more data within the next couple of months, we'll know more of those answers to those questions, especially regarding the transmission and then how safe you are months down the road. One of the questions asked, once Evergreen is fully vaccinated, will they be allowed to expand visitation to the general population, knowing that the general population will not be vaccinated? And that's also a good question. Most of the guidelines, or I should say all the guidelines that Evergreen and all of their assisted livings and nursing homes follow, they're guidelines from the state, or they're not really guidelines, they're sort of executive orders. So Evergreen and most other or all other nursing homes and assisted living facilities in the area don't really have a choice in the matter about how visitations and when they can open them, that kind of stuff. So unfortunately, at least in the short run, I don't expect the state to open up visitations. If everyone in the facility is vaccinated, I think they're probably going to look at vaccinating a certain number of the population in the general community before it's wide open. As it stands now, visitation-wise, if there hasn't been a COVID positive case in the facility for the past 14 days, whether it be a staff member or an elder, you can have visitations, but those visitations have to be safe. So if a facility can't manage those visitations safely without risking spreading COVID, they may hold off on starting those visitations. But I think we'll know more once more of the population is vaccinated, at least most of the facilities are, and then more of the community is vaccinated. I think we're going to get more changes from the state, from New York State. But these are all very good questions. So the one of the questions asked, if you have a reaction to the first shot, do you get the second, and what do they do for you? So again, that's a good question. So I think we have to differentiate the different types of reactions that you can get. So you can have a reaction which could be an allergic reaction. So if you have an allergic reaction to the shot, you probably wouldn't be able to get the second shot, unfortunately. You would still get the immunity from the first vaccine. You just wouldn't be able to get the full immunity, which is the 95%. Reactions that you could have, where you would still be able to get the second dose, would be general reactions, like feeling a little fatigued, feeling a little tired, having some fevers, and those reactions we expect they can last anywhere from 24 hours to 72 hours. Most people end up having symptoms from anywhere from 12 to 24 hours, but they can last 72 hours. Speaking from my own personal experience after getting the Pfizer vaccine, after having both of them, I personally didn't have any reaction after the first dose. After the second dose, the next day I was a little under the weather, a little tired, a little more fatigued. But all of that passed within 12 hours. And so it followed, the statements that that are being put out by the CDC with regards to side effects after the fact. And if you have those side effects after the first vaccine, it's not considered an allergic reaction. It's just considered part of the side effects of getting the vaccine, and you should be able to get the second one. One of the questions, so Julie mentioned, we're only doing supervised visits in our private dining room, not in-room or common area visits at this time. So that should help answer that question about visitations. And then someone asked, what have the side effects of the vaccination been? And so, like I said, the side effects are sort of the milder symptoms that you would get from a cold, or I should say from the flu. So symptoms being like fatigue, muscle aches, headaches, fever, chills. These are the kind of side effects people have been getting with the vaccine. The most common being the fatigue. With regards to allergic reactions, the allergic reactions that we're worried about, other than, so the common allergic reactions are reactions like rashes, like a mild rash that you can get from if you have an allergy to antibiotics. The reactions we really worry about are the severe, that are very rare, but we still worry about them, are the severe anaphylactic like reactions. So if you know someone that has peanut allergies, severe peanut allergies, they can't eat peanuts because their throat would swell up. Those kind of reactions are the ones that are really rare, but we obviously worry about them. The COVID vaccine isn't unique in the sense that it's not the only type of vaccine that can have this type of reaction. The rate of having these kind of reactions are similar across all other medications and all other vaccines. That being said, the pharmacies come out to deliver the vaccine, and they're always prepared with the appropriate medication. And I see Julie writing on there that they'll come prepared with EpiPens in case someone does have that reaction, a major allergic reaction. So far, I've seen 2 of my nursing homes fully vaccinated. One has about 120 people, elders, plus about 100 staff. The other is close to 100 elders and about 50 to 70 staff, and no one has had a severe allergic reaction. Most people, the reactions they're complaining about are like the mild headaches and fatigue and those kind of symptoms. One of the questions they're asking, if they have side effects, not allergic, will they be able to stay at Evergreen? And the answer is more likely than not, they'll stay at Evergreen unless the symptoms get so severe that they'll get sent out. But I don't anticipate that happening at all, just based on the mild side effects you can get from the vaccine the next day. And again, because they resolve so quickly, if Evergreen or the staff are ever concerned about someone being sick or someone having a symptom, they have appropriate directions to reach out to the physicians of the patient. So if your physician is me, or they'll reach out to me, or if they have another physician, they'll reach out to the physician to see what the recommendations are. But I don't expect people are going to get sent out to the hospital or anywhere else if they have these sort of mild side effects, which we expect. Most of the side effects we expect from the second dose, not so much the first dose of the vaccine. And the regular side effects that you do get are probably a good thing, because that's signaling that you're going through an immune response. It's showing you that your body is actually fighting the second dose of the vaccine, and it's creating an immune response, it's creating antibodies and other types of immune responses, so that when you actually get the virus, your body will be very well prepared. So getting these mild symptoms aren't a bad thing. And they're actually a good sign that your body's going to be able to fight the virus, or if you do end up contracting it. One of the question asks, can you take an Advil before the second shot if you have a reaction to the first shot, such as a headache? Again, very good question. Right now, they're not recommending taking any medications before the vaccine. Because there's suspicion that it might build the immune response. There's not a whole ton of scientific evidence behind it. But if you can imagine building the immune response, it's not what you want, because you want your body to be able to mount a good immune response. In cases like this, especially things like Advil, which are anti-inflammatories, you want your body to have an inflammatory response to the vaccine. So I wouldn't generally recommend people take Advil beforehand. If you start having symptoms after the fact, I think that's a different story. Advil itself is probably not a great medication in the elderly to begin with, unfortunately. Has a lot of side effects in the elderly. Tylenol is probably a lot safer with regards to its side effect profile. With fevers and that kind of stuff. But Advil, we generally recommend against anyway. But even if you're younger, I would recommend against taking Advil beforehand. But if you happen to have symptoms that you need some relief from after the fact, I think it's considered pretty kosher. I'm gonna keep an eye on the chat, or if anyone has any more questions, please feel free to speak up. Let's see. Otherwise, I can go over some more information about the vaccine. If I see any questions pop up, or if anyone has any questions, I can definitely take a pause to answer those questions. Going back to the side effects, most of the side effects from the vaccines, other vaccines in general, that we know of, don't occur beyond 6 weeks. From the data we're getting from the COVID vaccine, we're seeing 72 hours approximately. In order to approve these vaccines, FDA required 8 weeks of safety data, which is, I think, a good thing. They've gone a little beyond what's expected from other vaccines. I think one of the questions people that come up from time to time are how long will the immunity from the vaccine last? And currently, we don't know 100%. Right now, we think based on information from other viruses like COVID. So the SARS virus is very similar to the COVID virus and the MERS virus. The people that had the virus, most of those people are still immune. That being said, there's going to be definitely some population that's going to be able to get reinfected and sick again. And we've seen that with COVID as well, where people that were that had gotten COVID in the first surge, they recovered. We know they got COVID because they were sick from it. Not only did they test positive, they were also sick. They recovered after 3-4 months, and then they got sick again from COVID because they had symptoms and they tested positive again. So for most people, we assume are going to be able to retain some immunity for the rest of their lives, but there's going to be some population that may not. But again, I think we're going to know more over the next, over this year as we get more data. One of the questions is asking, what are the differences in the two vaccine types that are out now and the ones that are planning to be coming out soon? Again, good question. The two different vaccine types are, they use the same technology, which is that mRNA technology. So there really isn't a whole lot of difference. They're just, they were developed by different companies and universities. One is the Moderna, the other is the Pfizer, but they both work pretty much the same way. So that's why the side effect profile is very similar. Some of the other vaccines that are going to be hopefully coming out over the next year or so are more the traditional vaccines that you think about, where they have a part of the protein in the vaccine. And when you get the vaccine, you mount an immune response to the protein. And so, but right now we have the current vaccines that work really well. And so I think we're going to get there. Hopefully the more vaccines, the hope is as we get more vaccines, we're going to be able to vaccinate a larger portion of the population. The major limitation with just having two vaccines are that we only have a small amount. And so we have to really be rationing our supply and giving it to people that are most at risk, which are nursing home patients, assisted living patients, and older patients who live out in the community. So there's another question that's asking, once an elder has had both vaccinations, how protected are they from someone who has the virus? And so after the first dose, a couple of weeks after the first dose, you're about 80% to 85% safe. After a couple of weeks after the second dose, you're about 94 to 95% safe from getting sick from COVID. One of the questions is asking, once all the elders have been vaccinated, will they be able to have close contact again? Can they be seated close together at the same table in the same dining room? Again, that's a very good question. And I think we're going to need a little more data with regards to transmission that's going to hopefully come out over the next few months in order to best answer that question. As of now, we're going to be doing still distancing, unfortunately. And Julie also mentioned, you know, that guidance is, comes from the DOH, the New York State Department of Health. So there's not a whole lot of things that Evergreen or any other facility has room to function with. It's just what they're told to do. But, you know, I think we all understand the importance of physical contact, close contact, especially in our elders. You know, they're not able to visit with their family members. It's tough, and it has a big toll on your mental health. So we're really hoping that as soon as most people can get vaccinated, New York State can give us more updated guidelines, and we can start opening up things a little more. So our elders can have a little more contact, a little more quality of life. One of the questions asking, if someone has already had COVID, do they still need to get the vaccine? Yes, they should still get the vaccine. The guidelines currently are if they had COVID and they recovered from it about 10 days ago, they can get it. If it's within that timeline, they shouldn't get it. Or if they actively have COVID, they shouldn't get the vaccine. So for example, our first dose is going to be on the 24th. So 10 days, that'll be the 14th. So if you haven't recovered from COVID by the 14th, you probably shouldn't, 14th of this month, you probably shouldn't get the first dose. Let's see. So there's also some questions about the vaccine being a real virus. The vaccine that we're currently giving, both the Moderna and the Pfizer vaccine, they're not the virus itself. Just like most other vaccines, there's very few vaccines that are left around that we still use to this day that actually use the whole virus, or at least parts of the whole, taking parts out of the live virus and using the live virus. The example that I can give you is the old polio vaccine that are still around in most of the third world. They use a live virus. But the current vaccines, the vast majority of them, not even including COVID, they use parts of the virus that can't replicate, that can't translate into another virus. And even less so with the current mRNA vaccine. What the mRNA is coding is one of the proteins of the virus, and a protein itself can't really do anything except to help you mount an immune response to the virus. And so you're not going to get the virus after getting the vaccine. Just like most other vaccines currently, you can't get the virus from the vaccine, with those few exceptions that I mentioned, which is the old polio vaccine, which we don't give around here anyway. One of the other things I think I just really want to touch on is I think we're getting a lot of questions about this, are definitely what kind of things are going to be eased after everyone gets the vaccine. What kind of things are people going to be able to do at Evergreen that they weren't able to do before? And you know, that guidance is really going to come down from New York State, the Department of Health, with regards to what we can and can't do inside our facilities, inside assisted living facilities and nursing homes, because they also want to make sure that you know, we're being safe and our elders are being safe. So we're still going to have to wear masks and shields, at least for the time being, until we can get a little more data. Are there any other questions that I can help answer? Hopefully I communicated or was able to answer questions appropriately so far.
Excuse me, Dr. Khan.
Yeah.
Hi. I had a question about taking our mother into a restaurant, you know, say a restaurant after she's been vaccinated and after her, you know, 2 or 3 weeks following the vaccination.
That's again a very good question. And I think it ties into a few other things. One of the things it ties into is you want to keep close eye on the facility guidelines, because like we said,
she won't be with the facility later on. She's moving back home.
I see. So people that are going to be moving back home, so a couple of things keeping in mind, that the vaccine is about 95% effective. So there's still a 5% chance that you could still get sick from it. It's a pretty low chance, but it's still there. So keep an eye on the community rates of the virus. So currently we're at about 6.7%. We were at like 9.5, 10% a couple of 2-3 weeks ago. So we're getting better. I would say a pretty safe place to be would be below 1%. You know, I think we can get there. We've been pretty close to it at times. You know, as you remember, in the summer, restaurants were open again, and people were able to go about their, you know, not normal, but closer to normal lives. So hopefully we can get to that level again. But right now the levels are still pretty high.
Okay.
So I would make that judgment based on the community rates and, you know, your own personal risk, especially once you're out in the community. But if you're tying that into the facility, you know, just make sure the facility, you're keeping up with the facility guidelines. Yes, the facility may have guidelines for how long you may need to isolate for if you go out for certain things. And that's again to just keep everyone safe because, you know, you could be immune, but someone else couldn't be. And we don't know about the transmission just yet. I think we'll know more, but we don't know just yet. But that's a good question.
Okay. And the other question I had was, is the vaccine doesn't protect them per se from getting the virus. It just protects them from having the symptoms manifested?
So that's a question that I think we're gonna know an answer to over the next couple of months. So far, we know that it helps you from getting sick from the virus. So you could still potentially get the virus, be asymptomatic from it, which means you won't have symptoms from it, and potentially be able to transmit the virus. And that would be the worst case scenario of this vaccine. Because that means it'll be a little harder to reach herd immunity. The best case scenario would be you can't even get the virus because your body just fights it off so quick, and in that way you won't be able to even transmit it. That's your best case scenario. So we may see an answer somewhere between those or on one end or the other in the next couple of months.
Okay, thank you.
You're welcome. One of the questions asking, is staff required to be vaccinated or is it voluntary? It's very voluntary. We can't, or at least I don't expect that we're going to be able to require anyone to get the vaccine, any type of vaccine in general. I think, I don't think it's, I shouldn't say, I should say more, I don't know. It's going to be currently, it's all voluntary, so everyone who wants to get the vaccine can get the vaccine. We just highly recommend it. We haven't been like firing people or anything who don't want to get the vaccine. It's all personal choice. And you just have to weigh the risks and cons, the benefits and the cons of getting the vaccine.
We are encouraging all the staff to get the vaccine, and about 99% of our residents are signed up to get it. So we are encouraging all staff to get the vaccine. Julie and I are first in line.
Yeah, we really need those. I think it's a good, good step for all the leadership to get the vaccine, just to provide more reassurance to the rest of the staff. Oftentimes what I'm seeing in some of our nursing homes is the biggest hesitancy comes from some of the staff, but after they see their colleagues getting their vaccine at the first dose and everything's fine, they're a little more open to getting it when they come around the second time. So hopefully we're going to see a lot higher rates as we progress.
I also think it's the high testament that we have been COVID-free with our residents that shows how much the staff truly care about the residents and want to keep them safe, that shows that we're going to have a pretty high rate of those getting vaccinated because they really care about the residents staying safe.
I think that's a very good point. Anytime I've been there, I've interacted with the staff there. Everyone's very caring. They know all of their elders by name. I've been to places in the past, I worked at places in the past where, you'll talk to a staff member and they won't know who you're talking about. And I haven't had that experience ever at Evergreen or any of the nursing homes or facilities I currently work at. Anyone I talk to about a certain person, they'll know what's going on. They'll know them by name. So I think that's a testament to how caring I think Evergreen in general, I think most of our facilities in the community are. One of the questions asking who will administer the vaccine to the residents. I think Julie or Emily will be able to best answer that question. In some of our other facilities, the pharmacy itself has come out and vaccinated the elders and the staff. And Julie's saying it's going to be the CVS staff. So just like most of our other facilities, CVS staff is going to come out and do the vaccinations. I know in really huge facilities where they've needed help, they've asked for help from medical offices and stuff for nursing help. But I've seen one of the facilities nearby CVS came out just like an Evergreen, and they're going to do all the vaccines. And Emily's also saying it's going to be CVS.
Dr. Khan, can you talk about some of the common myths with the vaccine that you're coming across? Because I know the media goes one way or another, but what are you hearing that are definitely like, you know, you can myth bust some of it for us?
Yeah. I think the first thing I'd like to point out is anywhere where you get your information, just to make sure it's a credible source. Make sure it's from the CDC or New York State Department of Health. So you really want to make sure you look at those sources and where that information is coming from. Some of the things I think are important to notice is a lot of people worry about the safety of the vaccine. And I think what's important to notice is that over the last year, there has never been such a concentrated effort from the medical community as a whole to come up with a single medication or a multitude of medications for a single disease. And so all the scientists have worked very hard to come up with multiple different vaccines, and really a lot of money has poured into it. So a lot of people question the safety because of how quickly we got the vaccines to the market. But I think the important thing to note is we've also spent more time than we've had in the past than ever on this, on this effort. There's, in our lifetimes, there's never been a pandemic before. And in order to assess the safety of the vaccines, the FDA has looked at a couple of different advisory boards, and they're very independent advisory boards. They're vetted to not have any conflicts of interest with any of the vaccine makers, and they provide an independent assessment. And the assessment looks at both safety. It also looks at how effective the vaccine is, and also looks at what is the best distribution. And so all those three they looked at, and this is where we're at now with the vaccine, with all the information. Some of the things people worry about with the vaccine is the fact that it's a different vaccine. It's called an mRNA vaccine. Traditionally, if you think about vaccines like the flu vaccine, we take a small protein of the virus, we put it in a vaccine, and we give it to people. What the biggest challenge with the flu vaccine is it changes every year. The flu mutates just like all viruses do, and it mutates quite quick. And so we have to change the vaccine every year. One of the benefits of the mRNA vaccine is it encodes that protein. So even if there is a change in the virus itself, it's usually not big enough for us to, have to make a whole new protein. We can just use the same mRNA strand in order to have protection, in order to have that immunity. So for example, I can give you specifics on how the vaccine works. mRNA is a piece of the virus or piece of the vaccine that goes in your body, and your body uses your body's mechanisms to create the protein out of that mRNA. And your body then fights off that protein, and as a consequence, it creates that immunity response. That protein is not able to replicate, it's not able to do anything except just D. And so that's how we get immunity from the vaccine, at least this current vaccine. And that's how most mRNA vaccines work, and medications. These medications using mRNA have been around for at least a good 21, 22 years. Some of the medications that were originally used for, they've been used for cancer treatments. They were actually have been used for other viruses as well. There's a virus called CMV. It can cause eye infections, and they've been used in that setting as well. I think the first medication developed was in the late 90s with this technology. So the technology's been there for a while. It's a very safe technology. And so I have a little bit of background in research, in molecular research, and in clinical research. And just based on my background, it's a very safe and sound technology.
So question, the media is talking about a new possible more contagious strain that's coming from the UK, not necessarily more deadly, just more contagious. Would the current vaccine that we're about to receive offer protection for that type of mutation as well?
That's a good question. More likely than not, so far, the vaccine makers have told us it does offer that protection, and more likely than not, it will. The virus generally, any virus mutates the longer it sort of survives. And that's sort of inherent in all viruses. And so, there's a mutated strand from the UK, there's a mutated strand from South Africa. And more likely than not, we're going to be protected against it. If the vaccine, if the virus changes enough to the point where the vaccine won't work, we're going to know with the ongoing research. We're going to find out with ongoing research. But as of now, we know at the way it's currently mutated that we have good protection from it. One of the things I think to note about viruses in general, if they're the more contagious they are, they're in general more likely to be a little less deadly, because if they kill someone really fast, they can't spread. So it's in their sort of best interest to be as contagious as possible and as deadly as possible. But that's not a hard and fast rule. That's sort of an assumption we make about viruses in general. And it holds true for the most part, but not always. So I think that's important to keep in mind. But as of now, to answer that question, we are protected against it. And one of the questions asked me, has our area had any cases attributed to any of the mutations? I'm going to be honest, I don't really know if our county has had any cases. I don't know if, I'm sure there's some work going on behind the scenes with regards to doing genetic typing or genetic mapping or sequencing of active infections. But as of now, I don't know for sure if there's any cases attributed to the mutation. Some of the other myths that have been going around is that there's some 5G technology in the vaccine. I just want to clear up that myth that fortunately or unfortunately, we don't have quite that technology just yet to be able to put 5G inside people with a needle. any other myths that people can think of that that I may not have addressed today? Yeah. Yeah, unfortunately, we don't have any microchips, or fortunately, we don't have any microchips small enough to fit inside a needle.
What about for some of our staff that may be pregnant or nursing? Is it safe for a woman who's pregnant to be able to receive the vaccine?
So there's a society, obstetric society called ACOG, which puts out statements, and they've recommended it. You know, unfortunately, I don't deal in that field, so I haven't looked into it too much to say whether a pregnant staff member can get it. What we do know is when they do these trials, when they did the trials initially, although they didn't include any actively pregnant women in the trials, people that ended up getting, ended up finding out that they were pregnant didn't have any side effects. So we do have quite a bit of data from that, and that's what the ACOG Society is basing their statements off of, because they had enough data to say people who were pregnant and got the vaccine didn't really end up having any bad effects on the baby or on the mother. But just in all honesty, I haven't personally looked into that data just because it's not my field. But I would guide everyone to the ACOG website for any more information or ACOG guidelines with regards to the vaccine if you're pregnant and thinking about getting it. And definitely consult your, you know, OB gynecologist. You may have certain medical conditions that, you know, may preclude you from getting the vaccine. So you definitely want to talk to your doctor if you're pregnant, and you definitely want to look at those guidelines.
I don't know if this has already been asked, but is this a vaccine like the flu shot that you'd have to get annually or biannually?
That's a good question. As of now, we don't know. We're going to find out in a few more months with regards to how long the immunity lasts. Our hope is that based on previous virus infections like the SARS virus. Again, the COVID hasn't been around long enough either, but based on previous COVID or coronavirus infections like SARS, the immunity for most of those people have lasted pretty much lifelong. And so we're hoping we get the same immunity with the virus, with the vaccine, sorry, but we won't know for another few months. Whether that's the case, whether it'll be something you need to get a booster, or whether one will be enough. But I think we'll know more in the next coming few months. What we do know is the vaccine immunity should last at least 3 months or so, if not longer, depending on how the trials play out. But that's a very good question, and I think again that'll depend on more research that comes out over the next few months.
Thank you, Dr. Khan. And we have a couple more minutes if there's any questions left over. We have a couple more minutes left in our session, and thank you very much, Dr. Khan. And then I just have a concluding slide when we're finished, but we have a couple more minutes if somebody has a last minute question. All right, well, I am Emily, the Community Relations Director at Evergreen Place. Dr. Khan visits his patients here, and we thank you so much, Dr. Khan, for taking such good care of our elders here and in the community at large. And thank you so much for doing this for our families and community members. We really appreciate it.
Thank you. I think you all are doing a great job. And I just want to ask the families to just hang in there just a little longer, but I think you all at Evergreen are doing a great job.
Thank you. And this will be recorded, so if anybody would like a recording of it to share with family, don't hesitate to reply to my original email and we can get that to you. And thank you, Dr. Khan.
Thank you.